Hello friends, I'm here with my next video on understanding C-section. What is an elective C-section versus what is an emergency C-section? So as you near the end of your pregnancy journey, understanding your delivery options is essential. Generally, we are looking for a vaginal delivery or a normal delivery, but a cesarean section can also be required. So it's a surgical procedure which is used to deliver the baby through an incision on the abdomen and the uterus. So let's explore the different types of C-sections, elective and emergency, and what each one of them involves. So when is a C-section done? Whenever we cannot do a vaginal delivery, it's not possible or safe for the mother and baby, we do a C-section. So what is an elective C-section? It's a planned procedure wherein we know surely that the patient cannot have a vaginal delivery. So we are already discussing in the OPD on the date and a more comfortable time for both the doctor as well as the patient for the C-section. So what are the commonest reasons for an elective C-section? So generally, if there are obstetric and medical conditions like a placenta previa, that's a low-lying placenta, or baby is already in breech position where we can't give you a vaginal trial, or there are multiple pregnancies with twins or triplets and both the babies are in different positions, or if the mother is a previous C-section where already the scar is thinned out and we cannot opt for a vaginal delivery after C-section, there also we will plan for an elective C-section. Similarly, if the mother chooses her mode of delivery that I do not want a vaginal trial but I want to have an elective C-section, we can use an indication which is called a cesarean delivery on maternal request. So this also can be an indication for an elective C-section. So preparing for an elective C-section, you already know beforehand the date and the time of surgery. So you need to be fasting at least 6 to 8 hours prior to the procedure, and the admission is generally 3 to 4 hours before the scheduled time of surgery. According to that, all your investigations, everything are also done pre-hand, and you are directly taking into the OT complex for the surgery. So what is an emergency C-section? We've been waiting and trying for a normal delivery, but unfortunately circumstances are such that we either have to hurry up to deliver the baby because the baby is having difficulty inside, or we have our mother at a risk. So at that time when we do a C-section, it's called an emergency C-section. This is performed when our complications arising during labor or delivery. So the commonest reason for emergency C-section are fetal distress. When the baby shows certain signs wherein the heartbeat is dropping or the heartbeat is too fast, or if the bachu has done potty inside, so that's called meconium stained amniotic fluid. In that case, we would probably want to get the baby out as soon as possible. Also, if there is prolonged labor, we've been waiting 16, 18 hours and there's not much progress, the mouth of the uterus has not opened up or the baby's head has not come down, then also we may require a C-section. Also, if there are certain concerns on the mother's health, like such that the blood pressure is very high or there is excessive vaginal bleeding, then also we may be considering to do an emergency C-section. So the emergency C-section procedure is done so that we can get the baby out quickly, and we have to ensure the mother and the baby's safety both. The procedure and the steps are similar to that of an elective C-section, but here what we can expect is the bleeding can be little more and the surgical time can be a little more than an elective C-section. Understanding the difference between elective and emergency C-section can help you feel more prepared and confident about your delivery options. Whether planned or unexpected, the priority is ensuring the safety and well-being of both you as well as your baby. So discuss all your options and any concerns that you have with your doctor to make the best decision in your situation. Here's to a safe and successful delivery, mamas.